Hi everyone, welcome to the District 5 Town Hall this evening. I'm J.M. Brown, Supervisor Analyst for County Supervisor McPherson. We're going to let folks inch their way into the call here, and so we will get started in just a couple of minutes. Thanks for joining us. Okay, we'll wait just one more minute here until we see if some other folks are able to log on. All right, I'll go ahead and make some housekeeping announcements before we begin. As you heard when you logged on, this meeting is being recorded. We'll post it on the supervisor's county website as well as his Facebook page when the recording is available. Everyone is muted upon arrival this evening, and when we get to the Q&A portion of the meeting, you will be able to raise your hand in Zoom. When it's your turn, you will be asked to unmute yourself and you can begin talking. If you're joining us by phone, you can raise your hand by pressing *9. And when you are called on, press *6 to unmute yourself. We'll also offer opportunities to ask questions after each presentation. So with that, I'll turn it over to you, Supervisor McPherson.
Okay, thank you, JM, and good evening, everyone, and thank you for joining us for the first District 5 Town Hall of the new year. We're planning to have more of these town halls more often in 2022, as there's a lot to report on fire recovery, public health, infrastructure projects, and more. As was mentioned by J.M. Brown, my analyst, the meeting is being recorded. We posted on my county webpage, excuse me, and Facebook page for those who were not able to attend. We do have two featured presenters tonight, and both will be available for questions after their remarks. Then we will also have time at the end of the questions and other answers for other topics as well. Tonight, we're going to focus on health. First, we will hear from Casey Kirkhart, the Chief Medical Officer for the Santa Cruz County Community Health Centers. That's going to open a new primary care patients in Ben Lomond on January 24th, and I can't wait. I will be participating in the ribbon cutting ceremony at 9 a.m. that morning, January 24th, at the site, which is the historic Weekirk Church building, lovingly restored by Dr. Steve Lieb and his wife, Vivian, who practiced there for many years before retiring. Secondly, we'll hear tonight from Dr. Cal Gordon from our County Public Health Department. Dr. Gordon will give us an update on COVID, which many of us expected would be winding down now, but this Omicron variant has actually led to record high infections in our community and other communities, and with hospitalizations and deaths rising, it's still a critical topic, and we want to be have as much public awareness as we can on that topic. This is also another opportunity for us to thank wholeheartedly the San Lorenzo Valley Rotary Club for extending its Vax the Valley clinics at the Felton Community Hall through February, every Wednesday from 1 to 7 p.m. The clinic offer all versions of the vaccine, from including the first, second, and booster shots, and you can book at the website, and it's myturn.ca.gov. myturn.ca.gov. Also, there's a new series of vaccination clinics in Boulder Creek, thanks to the collaboration of our nonprofit community groups and businesses. The first one will be from 2 to 5 p.m. Saturday, January 29th at Lone Wolf Kenpo Academy. You can register at the link we are putting in the chat, but walk-ins are also welcome. Again, that's Saturday from 2 to 5, January 29th at the Lone Wolf Kenpo Academy. Our office also continues to work with the San Lorenzo Valley Water District on plans to annex Big Basin Water, which is a complicated process involving approval by state and local agencies. It will be well worth the effort if we can get Big Basin's 500 plus customers into good hands for the future. We're still fine-tuning plans to expand the Boulder Creek Sanitation District down or up Highway 236 corridor to support fire survivors and improve the sanitation in downtown Boulder Creek. That's a huge endeavor, but one that we are anxious to design and fund as soon as possible. We've been working on this for more than a year. On that note, I met recently with Congressman Jimmy Panetta, whose congressional district will now include our supervisorial district, which before was largely represented by Congresswoman Anna Eshoo. I have thoroughly enjoyed working with Congresswoman Eshoo closely for many years, but I also know that we will have a great representation from Jimmy Panetta. We have let him know about our sewer project and other issues that we have here, and we hope I may qualify for some federal funding. This is a huge project into the $30 to $40 million range, probably. Our office continues to work on fire prevention and recovery issues and have been pressing the state to ensure that it properly addresses the tree removal actions by PG&E immediately following the fire. On that note, please spread the word that those property owners affected by those tree removal operations, they have until January 31st to register for PG&E to remove those logs and other debris. You can find out more and register on our county's website. Jam from my office is putting the link into the chat right now for that. And remember, the deadline for registering to have that tree removal is January 31st. So it's critical that you act very soon. And lastly, we are still working hard to win state approval to cover more than $4 million in damage to our public roads and more than $5 million in damage to private roads caused by the state's post-fire debris removal contractor. So far, the state has declined to cover those costs, which are devastating to both the county public works budget and the pocketbooks of our private road owners. We are working to get the attention of the governor's office on this issue so we can get it resolved before more and more survivors try to rebuild. I also want to mention, you might have read some recent articles. I want to compliment the County of Santa Cruz, Metro, the Regional Transportation Commission, the San Lorenzo Valley School District for our cooperative effort to get something done for road improvements for that corridor between the school district, the complex, and the downtown Felton. That is going to take a lot of time and coordination, and we feel very confident that that'll be underway. I hope that it's going to take some time, but I think it'll be done and started by 2023 or 4. With that, I will turn it over to Casey Kirkhart from the Santa Cruz Community Health Centers to talk about the health center. And then we will open it up to questions about that project. And this is an exciting project, one that the San Lorenzo Valley well deserves, and we've been waiting a long time, and we're so glad to have you here. Thank you, Casey, and it's your show.
Thank you so much, Supervisor McPherson. I agree. This is an exciting opportunity for us, for Santa Cruz Community Health, and also for the community that we serve and that you all are a part of. This is actually, while as a new venture, this has been in the works to some degree for a long time, and something that we've wanted to do for a while, for a couple of reasons. One, many of us are residents of San Lorenzo, our staff are residents of San Lorenzo Valley. Myself, I'm a resident of District 5, and many of our patients are residents of San Lorenzo Valley and have to travel long distances either to our Women's Health Center or to our East Coast Family Health Center in Live Oak. Not to mention, we also know there's a tremendous need for primary care, for patient care in the area, not just because of travel, the difficulties there, but just access in general. There's a real need for primary care, mental health services, medical services in the area. So we think we've had our eye on this for a long time, and because of fortunate events, we're really, really happy to be able to open this health center starting next Monday. So I have a few slides to share, go into a little bit of the detail, and of course we'll have some time for questions. So I'm part of the Santa Cruz Community Health, and if you're familiar with health centers in Santa Cruz, we've been around since the 70s, and we really had as our mission to improve the health of our patients and the community. And we've been doing that for decades now. You might be familiar with our two health centers in Santa Cruz, one downtown Santa Cruz, the Santa Cruz Women's Health Center. And over the last 6 years, we've operated the East Cliff Family Health Center in Live Oak. And both of those health centers provide primary care to adult and pediatric patient population. We do prenatal care. We do health education around pregnancy. We provide an integrative behavioral health model where all of our patients have access to mental health services, including therapy, including substance use counseling and treatment. We manage chronic diseases like hypertension, heart disease, diabetes, and we assist all of our patients with access to important resources, including enrolling into health insurance, in particular Medi-Cal. We do a regular food distribution program. And of course, for the last 2 years now, we've been offering robust COVID treatment, vaccination, and testing in our health center. So we're excited to extend our care to San Lorenzo Valley, and so that our patients, both who are existing patients to our health centers who live in the area, or new patients who may not have access to a primary care provider, can now become a part of our patient community and have access to this array of services. We can go to the next slide, please, Jan. Great. So again, we're just so pleased to be able to open this new health center. Many of you may be familiar with the Weekirk Church in Ben Lomond. While we've been doing our healthcare venture for decades now, this site has really been in a historic place for serving the community, whether it's through providing a place of religious observance and service to the community since the 1800s, and more recently over the last several decades, where Dr. Stephen Leave and his wife Vivian have been providing incredible care to many patients in this area. So we are dedicated to not only serving the needs of our patient population, but also to continuing the dedication to serving the community and to responding to what you all need, what our patients need. So if you're not familiar with the site, it's here located at 9500 Central Avenue at Main Street in Ben Lomond, just one block up from Highway 9. And we'll be open every day of the week, Monday through Friday. We won't be open all day yet. We're starting off at a bit of a halftime schedule to start, and we won't be offering all of our services to start. but we wanted to establish ourselves, to get things going, to know that we're here for you in the community. And we'll have more detail. I can give you more detail on our schedule if you like. It will be also up on our website, schealthcenters.org. We can go to the next slide there.
Okay, give me just 1 second here.
Sure. There we go. Great. So just to share with you, as we get started, we'll be operating at 30 hours per week. We'll be offering services in mornings and afternoons. We hope to be offering services in the evenings, as well as perhaps even on Saturday as we expand further. We're going to start staffing with 3 physicians, myself and Dr. Rose Lovell, who herself is a resident of Felton, and Dr. Lilia Frank, who's also a resident of Felton. So you're getting physicians who know the community, who live and where we work. And so we feel like that's a great way for our patients to be connected and feel like they're supported and heard by our medical staff. Like I mentioned, we're starting out really with focus on getting established. So we'll have adult care. We will soon get a laboratory set up. We'll be able to provide more advanced services. We will be shortly, in the next few weeks or so, we'll start doing pediatric care, well care visits, childhood vaccinations, things like that. As our lab develops, we'll also start setting up for COVID testing. We've been doing a lot of rapid testing in all of our sites, and we've been had partnered with UC Santa Cruz. Now we're using Quest Diagnostics for our sending out COVID testing. And as you had heard, there are so many resources for COVID vaccination. So we look forward to working with others in the San Lorenzo Valley community to connect our patients to COVID vaccine services. Next slide, please. Great, and just to kind of highlight this, we've actually been, like I said, we were looking at ways to better serve the population of San Lorenzo Valley and our patients who are existing residents. And that's really part of our dedication to serving the entire Santa Cruz County community. So this is another step in expanding our services. We're also developing a brand new 20,000 square foot site, a clinic site in Live Oak, where we'll be right next door. We'll have dental services, and there'll be housing on that same campus. So we're looking to open that campus toward the end of this year. And again, if there are any questions now, I'm happy to answer even to any sort of detail. Please go to our website, schealthcenters.org, for updated information. We'll be posting the hours to the clinic, and as those develop, as those expand, we'll be adding to those. We've been taking appointments for visits for the last couple of weeks. We have a single phone number to our scheduling office right there, 831-427-3500. So anyone who is an established patient who wants to make an appointment, someone who is looking for a new provider, they can give us a call and we can talk with you about getting you enrolled. And we're booking appointments now. So again, really happy with this development, really excited to be able to serve your community, our community in this way, and our patients. And I hope that you are as excited as we are to welcome this new care team and this medical home into your area.
Okay, thank you very much, Casey. And I know Jam did, there's some questions on chat, I think, but does anybody want to come in directly?
Yes, and let me just remind them how to do that. You can raise your hand in Zoom, or if you're on the call, if you're on the meeting by phone, you can press *9 to indicate to us that you would. Let's see if we have anyone raising their hand, and then I'll go look in the chat. Okay, yeah, we've got some links in the chat. I'm not sure I see any questions yet. We do have a few hands raised. We'll call on Monica Martinez. and you can unmute.
Thanks, JM. Dr. Kirkhart, I just want to say how thrilled I am that you folks are coming up to the San Lorenzo Valley. We work together professionally. My children are also patients at Santa Cruz Community Health, and I can't imagine a more high quality healthcare provider coming into this community. I'm beyond thrilled. So thank you so much for expanding your services to Ben Lomond, San Lorenzo Valley. It's just such huge news for our community, and we're all thrilled about it. Thank you.
Thanks so much for saying, Monica. As always, we're so happy to be able to serve the community in this way.
Great. And now we'll go to Donna Zeal. Donna, you should be able to unmute yourself.
Okay, can you hear me?
Yes.
Okay, thank you. I too am really just thrilled that you're coming to the Valley. It's a much needed service, and I want to thank you for doing that. I do have a question though, and I'm kind of curious about how your services integrate with or duplicate or don't duplicate some of the services that, for example, Mountain Community Resources provide in the form of, food distribution and some mental health support, and Valley Churches also food distribution. Are you coordinating with them, or what's your vision there?
Sure, that's great. And as it's been wonderful to learn the different organizations in your area and how they're serving the community. It's really incredible to see the alliances and the shared commitment to the people in your area. It's really, really wonderful. And we do similar services actually out of our Live Oak clinic. So we do have a regular food distribution program there. And I don't think we'll be trying to at the outset or initially duplicate those, but I certainly think it's important for us to know about those services so that when our patients come to us for their medical and mental health care, that we can direct them to where they can access some of those much needed resources. So I think there's already partnerships that are developing, and having that information is really, really key. So thank you for highlighting those programs, and we'll look forward to collecting more information, getting some so that we can extend that information out to our patients.
Great, thank you.
Sure.
Okay, next we'll go to Ann Thrift. You should be able to unmute yourself and ask your question.
Yeah, hi. I wanted to say also thank you for coming to San Lorenzo Valley. We have had insufficient healthcare from what I've seen, being here 20-something years. My question is, I guess the main question I'm interested in is, Sutter Health PAMF in Scotts Valley stopped offering urgent care, and the supposed walk-in care they have is pretty inadequate now too. I guess what my question is there any possibility that you guys are going to offer some sort of urgent care services for people that aren't necessarily your full-time patients?
Right. I think there are two parts to that. One is our scope. How are we doing urgent care, same-day care? The other is, can we serve folks who are not our patients? And there's some wiggle room around both of those, I would say. In our normal clinic operations at our two other sites, we do provide same-day access. So if patients call in to our single number, they can be triaged by a nurse. We can make arrangements to have them seen that day but we do have a schedule where we're booking appointments. So it's not a walk-in sort of operation, although we can oftentimes make accommodation. Sometimes that might not mean being able to see the patient in that site, but we could connect the patient to one of our other sites. We would be able to provide some clinical guidance then and there. So while not an urgent care, and we'll not be able to accept all patients with all healthcare concerns, we will be able to point someone in the right direction and give them proper counsel. In terms of folks who aren't our patients, again, I mean, we can flex to do that to a degree. I certainly know if someone came into our offices today who wasn't our patient who needed emergent medical care, we would guide them and counsel them, but it's not part of our greater operation. So I don't think it will be quite the extent that an urgent care would offer, but we will certainly won't leave anyone without being pointed in the right direction.
Okay, thank you.
Sure.
Okay, let's see if we have any additional questions. Again, you can raise your hand in Zoom or you can press *9 if you're joining us on the phone. And I don't see any questions in the chat. So Supervisor, I think we're ready to shift gears. And you're muted, Supervisor.
Oh, boy, you think I know by now. Excuse me, I'm sorry I was on mute. I'd like now to introduce Dr. Cal Gordon, the Deputy Health Officer and CMS Medical Consultant for the County Public Health Department. Dr. Gordon, thank you for being here. We appreciate what you do in this ever-changing world of COVID activity and response and advice and so forth. So thank you for everything you and I'll spread that out to all of the health-related officers and employees for the County of Santa Cruz. They have done a phenomenal job for the last 2 years, above and beyond the call of duty. And we thank them very much. And I hope that you can pass that on to them as well. But Dr. Gordon, if you could just give us an update on the COVID situation that we have here in the county, in the 5th district, and then overall too, some of the projections possibly. Thank you.
Thank you so much, Supervisor McPherson, and I really appreciate the opportunity to share what's happening with COVID in both on a larger scale and also at the county level. Also, congratulations to Community Health, Santa Cruz Community Health, and their presence in Ben Loma. That's absolutely great. For the record, I'm a pediatrician. I grew up in Scotts Valley, went to Soquel High School, UC Santa Cruz undergrad. I have a 98-year-old mom in Scotts Valley still, who's doing well. And so I got drafted, I had retired and got drafted by public health with the beginning of the pandemic. And I've been with public health for almost 2 years now. So if we could move into the slides, James, that would be great. So I have quite a few slides, but go fairly quickly and be happy to touch on any of these topics as we move along. So we'll keep moving. On a large scale, this gives you sort of a global view, and it shows you from the beginning of the pandemic, all the different continents, the amount of documented COVID cases. And you can see where last winter we had the winter surge, we had sort of over, more recently, we had the Delta sort of surge, July through August and September. And if you notice, the numbers are just staggering. The numbers have gone up in a big way with the Omicron variant. And that's in part because it's highly transmissible. It's like measles. You can potentially even catch it going into a room after somebody who's had with active COVID has left and potentially catch it that way. It's also seems to escape prior immunogenicity. If you've had either vaccines or prior infection, you can easily catch this. For people who have had 2 vaccines and have not had their booster, the vaccines are only about 30% effective against this particular variant. That's the bad news. The good news is that the severity of illness seems to be less. And it's only about 3% of people get infected, need to be hospitalized. But just based on the sheer numbers, you can potentially have a whole lot more hospitalizations. And we have had 3 recent deaths in the county from this. We'll move to the next slide. There is some hope. This is a bit of a busy slide, and this comes from England. And if you remember, Omicron started both in Europe, first South Africa, and then Europe, and England was one of the hotspots there. And what this has is sort of both the case rates for the entire pandemic in England, and as well as hospitalizations and people who needed ventilation, which is like went into the intensive care unit, and those who have had confirmed deaths. And what you see is, at least with the winter, the first major surge that we had in the winter, everything kind of corresponded. And then with the immunizations that occurred in England, there was a kind of a separation in terms of number of infections with the Delta virus, as well from the actual hospitalizations and deaths and ICU admissions. And that has been even more significantly separated with the Omicron. But the other thing that's remarkable about this slide is you see this dramatic sort of almost ice pick type surge, but it's coming down equally quickly in England. And so that you can see that there has, in the United Kingdom, there's been a dramatic increase, but now they're on the downward slope. And there's some indications that's also happening in New York, which is about 2 or 3 weeks behind what happened in United Kingdom. And there's some potential indications that maybe actually should be happening relatively soon in California. I'll move to the next slide. This gives you the overall state data in terms of vaccines administered for the state. We've done 67 million vaccines so far. We've had 6 million plus cases with a 86,000 daily average currently. We've had 76,000, almost 77,000 deaths, 46 per day on the average. This is as of January 16th for the past week. And the positivity rate is 22.9%, which is super high, but it is slightly lower than it was last week, where we were at 23.1%. So it looks like we may be, at least the positivity rate, we may be flattening out. We'll move to the next slide. This shows our reproductive number. So if you see the black line going across, at 1, it's like for one, if one person gets infected, they will infect one person if another person. And we're up at like 2 plus, so that for every one person infected, they're infecting at least 2 plus. So we are still on the upward slope. But you can see that there may be some flattening out there in terms of the reproductive number. And we'll go to the next slide. This is some studies over in Santa Clara County, where they're looking at the wastewater, and the virus is shed into waste material. And Santa Clara County has been looking at that. Marin County, there's some few other sites, San Mateo. And the amount of virus in the presence of a particular variant precedes signs of actually picking up case rates, oftentimes a couple weeks earlier. And if you look here, the viral load of Omicron has actually decreased in the wastewater. So it is suggestive that within the next week or two, it's likely that in Santa Clara County that those numbers the actual case rates will go down. Santa Cruz County is typically about a week or two behind what's happening over in Santa Clara County. We'll keep moving on. So this shows our own results that we have on our website locally, and it just got updated today. And so I prepared these slides over the weekend. And so we, instead of 3,000 active cases, we actually have 5,421 active cases. So with the last week, we've increased it by another 2,000. And we've had actually 5 deaths recorded since that time. And so even though Omicron is less severe, we are still having deaths associated with that. The most common form of sort of transmission, from what we can tell by our contact tracing, is that this is community acquired as opposed to household or from other places such as school. We'll move on to the next slide. this gives you a sense of, again, how our county is doing compared to the state. And you can see that we pretty much mirror what is occurring in the state, also has been occurring in our county. And this shows you through the entire pandemic. And you can see that just as the state just peaked at a just dramatic rate, so has our county when you kind of superimpose these case rates. And as you can see, last winter we had a huge surge. It was the highest number until we hit Omicron, where we're more than twice the numbers on a daily basis. Keep moving forward. If you look at this, it gets into some of the demographics, and for the active cases, where are they most common in terms of age groups? It's primarily the 25 to 34-year-old age group, followed then by the 20 to 24-year-olds, and then the 15 to 19-year-olds. And so it is that population, and they often are the groups that are the least vaccinated. So there is probably some correlation there, but this is where the highest infection rate in our active cases are. And we have the older population has a higher group of immunized and boosted individuals. And you can see that the case rates for that group, then they're the most at risk for a potential hospitalization or death. You can see that those numbers are actually less than the other groups. We'll move on to the next slide. This speaks to the death rate, so just the total amount of deaths, and you can see that for our county, the group that has been hit the highest has been the older population. And for those people who have been in skilled nursing facilities or in residential care facilities, they account for approximately half of all of our deaths. Next slide. This is a little bit difficult graph to see, but I wanted to point out a few things. We are looking at 3 parts of our county, and demographically, we have the North County, we have the South County, we have Mid County. And the very first wave through the last winter was primarily in the South County. It was hit in a disproportionate fashion. You can see that it was approximately twice what it was last year in the South County. But if you look at the Delta wave, which is sort of the August-September piece, and also with Omicron, it's the North County first and then the Mid County that have been hit. And so the North County was relatively spared in the last winter, and both for Delta and for Omicron, North County has been hit in a big way. We'll keep moving forward. We also project, as best we can, hospitalization and ICU admissions and deaths. And one of our whole goal is to what we call flatten the curve. You saw that deep peak. Our concern is that with an excessive hospitalization rate, that then there could be the point where we won't have enough ventilators. We'll have to make some hard decision who gets a ventilator. And it also can keep people who have heart attacks or other reasons for coming into the hospital, their inability to receive care because all the beds will be occupied by people who have COVID. And so the good news is that we are doing actually quite well on our hospitalization rates. We had a bit of a peak collectively between Dominican Hospital and Watsonville Hospital. I think we only have roughly between 25 and 30 individuals that have COVID, and a fair number of those weren't hospitalized for the COVID. They actually came in for something else, and they were tested, and they happened to have COVID, but they weren't actually being admitted for the COVID. And so at this point, our capacity and also our intensive care unit capacity is doing okay. And our ICUs are relatively full, but they're not necessarily with COVID patients. We'll move to the next slide. And this is sort of where we are in terms of COVID patients in the ICUs. And so even when people are having COVID, it's they're not necessarily going into the ICU. And with the Omicron, it seems to attack more the upper respiratory area, the bronchi, the large tubes of the lungs, but not into the lungs proper, and so are not necessarily needing ventilation and intubation. So this is our projection. We still think it could be, it could exceed our capacity for our ICU beds. If you look to the far right, this is something maybe that will move on into the early parts of February. And so we'll be following this very closely because this is our main concern. I will also say that it's not just having the beds for our patients, it's having the staff. And we've had large portion of staff, both at Watsonville Community Hospital and Dominican, get infected with COVID and have to stay home. And so we've had between 60 and 80 at Dominican, in the 30s at Watsonville. And this is of concern to us that we won't have the staff. And so we actually have people from our emergency medical services training and working to assist Dominican Hospital so that we can maintain capacity for our patients. We'll go to the next slide. And this is, again, our projection for potential deaths. But if you look on the y-axis is 1 or 2, we're talking about a very low rate of expected deaths likely to occur over the next month from the Omicron. And we'll keep going to the next slide. This is a really busy slide, but I just want to show you where Santa Cruz fits in the kind of greenish component. San Francisco, San Mateo, Santa Clara were a bit below us initially. With the Omicron, we're all very similar in the same group cohort as the Bay Area for the number of cases per 100,000. We'll move to the next slide. This is an important slide. It's a little bit difficult to read the graphs, but this gets updated in the state dashboard every week. And this is the most recent data as of over the weekend. So the Omicron, again, is infecting more people who are vaccinated. Before you had like an 8 times less likely to be infected if you have been vaccinated. And when we say fully vaccinated, it's the people who have received two vaccinations of the messenger RNA, as opposed to with the booster. But you're still, you're 3.8 times more likely to get COVID if you're unvaccinated than if you received two vaccinations. You are 8 times more likely to be hospitalized, and you're more than 20 times more likely to die from the COVID if you're unvaccinated. And these are the most recent data points that we have from our state website. The next slide shows you the difference between if you've had the 2 versus the 3rd booster vaccination. And you can, the green line is those who have been boosted, and the yellow line is those who have received the 2 vaccines. And you can see that there is a distinct difference between actually getting infected. If you've had the booster, it's something on the order of 88% likelihood of protection against actually getting infected with COVID. Again, a lower percentage of hospitalizations or deaths. And this is based on the state data. Next slide. Talking about vaccination, the best form of protection is being vaccinated. And this shows you all the vaccines that we've administered. We've administered over 212 vaccines as of a rolling 7-day average over as of last week. We'll keep moving forward. And this, I am really happy to be able to show you. Basically, this looks at the 3 quartiles. We don't have a quartile 1, which is sort of the lowest quartile in terms of social determinants of health. This is like health access. It's also relates to education and a number of other social determinants. And what it shows you is that those who live in the quartile areas actually have received as much or actually more vaccines than those who have in the upper two quartiles. And what we want, one of our mantras is equity for all populations to have access to vaccines and testing. And this has been one of our priorities from the beginning of the pandemic. We'll keep moving forward. This shows you our total number of boosters. Roughly close to half of our eligible population for boosters have received it. We've given almost 90,000 boosters as of about a week ago. We'll move forward to the next slide. And this shows you based on age. So those 65 plus have close to 60% have been boosted, 50 to 64 years of age, 49%. And you can see the younger groups have received less boosters, as in part because they haven't been eligible for booster for very long. But this gives you a sense of where we're at and that by age groups. Keep moving forward. We have a number of recent new guidances, both by the CDC as well as the California Department of Public Health. And some of this, I'll move forward to the next slide. And this is on our public website. There have been, I think people know that there's been shortened isolation and quarantine guidance. There's some science behind this, in part because with the Omicron, it seems that the incubation period is roughly about 36 hours on the average. So it's much faster from time of exposure to the time you actually come down with symptoms or you start being infectious. But the period of time that you're infectious also is reduced by a few days. And so the CDC came up with some recommendations, and what's different between the state guidelines versus the CDC is that the state is saying that for if you're test positive and you isolate, that you can potentially go back into work in other settings if you test negative, preferably with an antigen test, because the PCR, you may not be infectious, but you may still test positive on the PCR. And so that's why the antigen test is being recommended. And similarly, there's the for quarantining, there's similar for general public. It's recommended that you quarantine for at least 5 days and then test at day 5. If you can't test, then that you would stay quarantined for 10 days. If you do go back to general public, it's recommended for the remaining 5 days that you mask for that period of time. And people have been fully boosted or aren't booster eligible. It's people don't necessarily have to quarantine. They should mask and they should test at day 5. So those are the current recommendations. Next slide. For healthcare guidance, because of the personnel issues and for certain hospitals that they've had a hard decision because whether they may have to close services versus bring back people who are actively that have tested positive. And the people who are being potentially brought back would be working with patients who are actually known positive. They would be limited to those environments for the most part. This is, I don't believe this has necessarily been a lever that's been utilized by our hospitals locally. Next, and this is only through for the next few weeks. There is a state order for masking, and this will continue to February 15th. And there has been also a local masking mandate that does not have current end. I think we're all looking for a time where we believe that the case rate is low, that we think that the likelihood of getting infected is low. I would also, if we move to the next slide, would want to point out that the cloth masks are not very effective against Omicron. There was one study that showed if you had 2 people in a room together and you had a cloth mask, the likelihood of if one had active Omicron, that it would probably take about 37 minutes to get infected. If you have a surgical mask, it would take you about an hour. If you have an N95 or possibly a KN95, it could take you up to 25 hours to get infection. And so the choice of mask is very important at this point with the Omicron. And it's suggested that that if people can go to the KF94, the KN95, the N95s, that they will serve you well if you're out in the public. And you should assume that if you're in sort of a public area, that there's somebody, it's roughly 5% of the people out there minimum with surveillance are likely to be having active COVID at the time. And so being masked is going to be very important. Next slide. Jam. Okay, are some booster requirements specific for certain types of working environments for healthcare workers, people who work in adult care facility or skilled nursing facilities, correctional facilities. These are settings that are very high risk, and so there are mandates for these individuals to get boosted so that they are not just safe for themselves, but for the people they provide care for. Next slide. Just wanted to mention some of the therapeutics. Some of this is very exciting. One sort of not so exciting point is that most of our monoclonal antibodies, the antibodies that you get by infusion, are not effective against the Omicron. The only one that is effective for people who have infection and receive treatment is called sotrovimab. And the unfortunate part is that we, as a county, get this from the state that gets this from the feds. We only have gotten like 20 treatment courses of this, so we're very restricted on this. Evusheld is a similar type of monoclonal antibody, but it's for people before they get infected, for people who are highly immunocompromised. If they've had a transplant, they're on chemotherapy, they're at high risk. This can protect them, and it has like an 88% effectiveness for keeping people from getting an infection. They can have, if they get vaccinated, the vaccines aren't as effective because they're immunocompromised, so they can't mount a good protection for themselves. And we're only getting a very limited course of like 20 for those. I think we may be getting another shipment, but it's very restricted. There are also antiviral agents, and this has huge promise. The molnupiravir is an oral antiviral. It has not been, it's only about 30% effective. It's put out by Merck, and it also has some potential toxicity for mutagenicity. So for people who might get pregnant, the equivalent, it's contraindicated. So this is probably the one that we recommend the least. The one that's really highly encouraging is the Paxlovid. This is, it has an 88% effectiveness. It's a 3-day course, a 5-day course. It's just, it's twice a day. It's a very, it looks like it will work in a very effective fashion. But again, we get only a very small handful of these. We got 20, and I think we're getting another 40 that in the county. And we're working with our infectious disease specialists to work with the primary care physicians to really decide those who are at the highest risk of stratification, that they be provided these treatments just because of the sheer lack of this. I do think that the numbers will increase, but it's going to be many weeks before we see high numbers of this. But this in the future, I think, will be serving us very well in terms of some additional protection. We'll move to the next slide. So our local responses, vaccinations, trying to update the public in terms of all the confusing guidances that both the CDC and the state have put out there, trying to really make sure that the people who are most at risk of keeping the hospitals open, and those who in the residential care facilities, skilled nursing facilities, jails, and schools, keeping them safe. That's been our focus this most recent surge. And next slide, I think that speaks to our focus as the county. And as we get through the surge, which we believe isn't going to be that much longer, a matter of weeks, as opposed to last winter when it was a matter of months. Next slide. We have put out recent messaging really asking people, you should stay home unless you think you have something, a true emergency. Testing positive with Omicron necessarily doesn't warrant going to the emergency room. If you have shortness of breath or you feel like you are having other major difficulties, yes, but otherwise see your regular doctor and stay home, get tested, stay home, and that try to keep our hospitals functioning so we can deal with the emergencies that come through the door. Next slide. We do have testing opportunities. We have our state-sponsored testing. We do have in San Lorenzo Valley, we have the Mountain Community Resource Building. We test from Friday through Tuesday, and we have extended, are trying to increase our capacity there. Staffing has been a real issue just to get people there, but we really appreciate Mountain Community Resource and Community Bridges working with us in providing testing, because testing has been a real challenge in San Lorenzo Valley. We also have, we moved out of the Civic Auditorium, but we are at the Depot Freight Building, which is down a few blocks from the Civic Auditorium on Center Street. And then we have the Ramsey Park site in Watsonville. If we did have National Guard come in because of staffing has been such a challenge these past few weeks, and that has actually been received well by our community. We'll move to the next slide. And I want to give kudos to our County Office of Education that in a big way has increased testing capacity at the Santa Cruz County Office of Education on Encinal Street in Santa Cruz, but also at Cabrillo College, at Pajaro Valley Unified School District. And now they've increased, the county has worked with them to have a large testing capacity at the Santa Cruz County Fairgrounds to meet the surge. And this, the numbers, they're literally doing thousands of tests on a daily basis in conjunction with the state-sponsored test sites that we have. Next slide. We do have expanded opportunities, and we do have Vax Valley at Felton Community Hall, and we appreciate that partnership, and that can be found, as noted by Supervisor McPherson, on the My Turn website. Next slide, and I'm almost done. So the key messages are, this month has been really hard, and I think we've all are exhausted from almost a 2-year period of pandemic, and especially with this Omicron, where we know family members, friends, neighbors who have been affected by this. Our goal is really to keep our health system alive through this. You should assume that people around you may be infectious, so it's good to mask. And even though you do everything right, you still can get positive. This is the nature of the Omicron. But individual behaviors do make a difference. It helps slow the spread. And so we appreciate the people that have made every effort to adhere to good behaviors. And again, flattening the curve keeps our hospitals open and serves our community. And the last slide is just a major thank you. And if you haven't gotten vaccinated, please get vaccinated. So I'll be happy to take questions. I know that was long and I kind of whipped through those, but I do think it gives you a sense of what has been happening most recently.
Yeah, thank you, Doctor, for that really detailed presentation. It's very interesting to know, and it's very difficult to get ahead of this situation. Are the vaccination and testing clinics are making a difference in the rate of the spread in the San Lorenzo Valley? I mean, I know Vax the Valley, the Rotary Club has sponsored that, and we have the Mountain Community Center or resources. But there's been more than 1,000 vaccinations at VaccinesAdministered Valley. Can we assume that those, are you assuming those wouldn't maybe have been vaccinated otherwise, or is there any projection? I know it's valuable, but I'm just trying to get a gauge of how valuable it's been.
Well, if you think about it, you're in terms of deaths, I think we've saved lives just by having vaccination in the Valley. I am absolutely sure it's not something you can document or quantify, but just statistically, we have saved lives by getting our community vaccinated. And I think having access close by where you can receive this, and it's easier for our residents, absolutely important. And getting tested, knowing you're positive, staying home, and isolating saves lives. And so all of these things are extremely important. It's just like before children returned back to school, the County Office of Education actually gave out 40,000 test kits, and roughly 3%, 5% of the school children tested positive, so they stayed home. So all of this testing adds value. And I do believe that the future, we will have a broader distribution of testing. I actually went online. If people don't know, people can go online, and I can send this to you, but you can go online and with the post office request, each household can get 4 antigen tests sent by the federal government. It just started as of today. And we won't probably get the shipment until for at least a couple more weeks minimum. But I believe that antigen testing will be the future, where people will have more access, and they'll be able to test in the comfort of home when they've had exposure, or they may be symptomatic when they really would like to test. And I think that will be add great value in the future.
Dr. Gordon, I had a question on that note. So because of the greater availability of at-home rapid tests now, should folks who test positive or negative be reporting that to the county so that the statistics are maintained with some?
Not to the county, because we just don't. The county, you think, is this mammoth machine, right? But people working in the COVID lane, I think there's about 100 of us, working on this, and some of this is doing contact tracing, some of this is doing vaccination, all the rest of it, and so it's a fairly lean machine. And with the antigen tests, there are, depending on the type of test, there is the opportunity to be able to report it online. And with that reporting process, it goes to the state database system, which comes back to the county, and then we can see it in a broader sense. And so if you report it to the county, we're not going to be able to absorb those numbers. So if you'd like to report, but I do think the likelihood is the future reporting will be less and less, and it will be a matter of people knowing personally, and then acting on it by reaching out to their regular doctor as to their symptoms, what should I do, and the equivalent. And we view kind of the future for county is to really help people understand what's within their power of action, and advise them as to what are advisable steps, so that people can take on that responsibility themselves and work with also with their medical providers.
Oh, thank you. And Dr. Kirkhart from Community Health Centers has been kind enough to put that USPS link in the chat.
Thank you, Casey.
And so before I go to folks for questions, there was a message put in the chat, a question from Justin Norgreen, and that is, if cloth masks are not effective, why do children still need to wear them, especially since they're at such a low risk for COVID? The data being presented here also show this much.
Well, actually, children get the infection at the same rate as do adults. For the most part, they weather quite well. We have had on the order of about 800 pediatric deaths nationally, so it's quite rare, but you can there are deaths associated among children. It's typically a delayed response, but you can be significantly ill from COVID. So I will say that the County Office of Education, the schools have received N95s from the state. They are most of them are for the large size, and they're good for the high schoolers, are not effective. There is some protection with the cloth masks, but we would recommend actually using either a surgical mask that's well fitted, or potentially one of the other forms of like the N95 or the N95s.
Okay. Thank you. So now we can open it up for questions. You can raise your hand in Zoom, or if you're on the phone, you can press *9 to let us know that you'd like to ask a question.
While we're waiting, I will also say that for the locally, we can only provide guidances and requirements that are more restrictive than the state. Then if the state has a mandate, locally we must adhere to that. We cannot provide a lesser requirement. And so the masking for schools, the equivalent is at the state level in terms of that particular mandate.
Okay, yeah, good reminder, thank you. Anyone question regarding COVID status? If not, we'll move on to general questions and answers. Okay, Mr. Supervisor, I don't see anyone with questions on this.
Okay, well, I appreciate the opportunity to share this with you. I hope I tend to enjoy data that may have been too detailed, but hopefully people got a sense of what has taken place. So thank you.
Okay. All right. Yeah, go ahead, please.
Do we have any other questions on general topics that have come in?
Folks can raise their hand in Zoom and or press *9 if you're joining us by phone. I'm not seeing any here, Supervisor. No one's indicating they have a question.
Okay, maybe we'll move into closing then. If you have any questions, please just raise your hand anytime. But just to review, well, I want to thank Casey and Dr. Gordon for being here today. A couple of those important dates: the ribbon cutting for the health center in Ben Lomond at 9500 Central Avenue is January 24th at 9 a.m. A reminder too about the January 31st deadline to register for PG&E tree removal. That's on the Santa Cruz County website for more information. That's really critical because we want to have PG&E. We negotiated with them, and they said, okay, we'll do this, but we've got to have some kind of a deadline. So be sure to register, or tell your friends and neighbors to register to have the PG&E tree removal, and they can go to the Santa Cruz County website for that. The VaccinesAdministered Valley, after the great presentation by Dr. Gordon, all that information is important. I mean, really, we need to know everything about every aspect of this. But that's at the Felton Community Hall Wednesdays 1 to 7 p.m. At the Felton Community Center. So do not forget that. We will continue to work on our big basin consolidation with the Lorenzo Valley Water District. That's critical. That's going to take some time, but we have the agencies that work to get that done, so people can have a good water system up in Big Basin. So I think and then the testing at the Mountain Community Resources Friday through Tuesday, 10 a.m. to 6 p.m. So those are all important. There's a lot of things that people can do to help fight this COVID situation. And many other various agencies have come to the front to say, hey, we want to help, and they're doing that. So take advantage of that. We're going to be better off if everybody does take advantage of that. So I really do appreciate the efforts that so many of our friends and neighbors have done to make this testing available and to let us know the information that we need for VaccinesAdministered Valley and other issues. So please attend these events and say thanks to the people, your friends and neighbors who have made them a possibility. They're all for you, and they're going to help us. So I really want to thank everybody for the speakers tonight and for those who attended. And I hope you had a wonderful Martin Luther King Day holiday on Monday. As always, you can reach our office through email at 5th.district@santacruzcounty.us or call 454-2200. Now, I don't know if was there a couple chats that came in, Jim?
Yes, Mr. Nordgreen was asking some additional questions regarding COVID, but what would you like to take them now, or would you like us to just connect him with Dr. Gordon so he could follow up?
Is it specific to Dr. Gordon?
Yes, he's got them in the chat here. Currently, he's having trouble raising his hand. So if you'd like, I can go ahead and read his chat. This COVID seems to be following traditional nature of the virus as it evolves, and Omicron is significantly less severe than previous variants. Shouldn't we be able to return to normal at this point?
I think that's everyone's hope, that we can return to normal. I think no one, including myself or anybody out there that I'm aware of, can predict what the next variant. I think it's likely that we're going to see another variant, but we can't predict whether it's going to be like the Omicron, where it's not as serious. It could be much more serious. So I'm going to be impressed if it's more infectious than Omicron, since the Omicron is exceedingly infectious. Justin, or Mr. Nordgreen, I'd be happy to talk with you directly. I can get you contact information and we can talk further. But my hope would be that we see at least a period of time where we can resume, more normal activity. And I think that is what everyone is wishing for. If you look at the Spanish flu about 100 years ago, I think there was about a 2.5-year period of surges and waves, and then it seemed to peter out. We don't know if that's going to be the case with the COVID virus at this point.
Okay, any final, we'll make sure that your office is connected, Dr. Gordon, to Mr. Nordgreen.
Okay, thank you.
I don't, Steve, we have any other questions?
Okay, well, I just generally want to say thank you to everyone. Some great information, some great things that are happening up in the San Lorenzo Valley, and we're really very pleased with the efforts that everybody have made to make this a healthier and safer community for all of us in Santa Cruz County, but in particular San Lorenzo Valley. We've really been able to target some attention to the Valley, and we're very pleased with it. And we can't thank you enough for the health centers opening. It's going to be fantastic. It's just going to be a great addition to the San Lorenzo Valley. So thank you, and for all those other things that are going on in the San Lorenzo Valley. And with that, I think I would just wish everyone have a great evening. It's going to be cool, but stay safe and do your best to protect yourself and to protect your friends and neighbors as well, as this COVID thing goes on and on. But we'll beat it, and we'll be on this before we know it, I hope. So with that, I wish everybody the best evening that they could have, and we'll see you in our next town hall, I hope. Thank you very much.
Thank you. Now.